Biomedical waste management is a critical discipline within the healthcare sector, focusing on the systematic control of waste generated during medical activities. This presentation provides an in-depth exploration of the protocols and standards necessary to protect healthcare workers, patients, and the environment from the hazards associated with medical byproducts. Proper management is not merely a logistical necessity, but a fundamental requirement for public health safety. Throughout this lesson, we will examine the international phrase practices, ensuring that waste is handled with the highest level of care, from the point of generation to final disposal. Understanding these principles is essential for any professional operating within a clinical or laboratory setting. WHO guidelines and the Blue Book serves as the foundational topic for our second module. The World Health Organization, or WHO, acts as the primary international body for establishing health standards, and their specific guidelines for waste management are recognized globally. The Blue Book is the colloquial name for the comprehensive manual that details every aspect of handling medical waste safely. This section will introduce how these guidelines are structured and why they are considered the gold standard for healthcare facilities worldwide. By adhering to these internationally recognized protocols, countries can ensure a uniform approach to mitigating the risks of infectious diseases and environmental contamination. The Global Reference Standard is defined by the WHO's publication titled Safe Management of Wastes from Healthcare Activities, commonly known as the Blue Book. This document is the definitive manual for the industry, offering a comprehensive look at the legal, administrative, and technical aspects of waste handling. It provides technical, internationally recognized guidance for safe and affordable biomedical waste management, ensuring that even facilities with limited budgets can implement effective safety measures. The manual is designed to be a practical tool for policymakers and practitioners alike, offering evidence-based solutions to the complex challenges of disposing of hazardous medical materials while maintaining cost-effectiveness and safety. Evolution of WHO guidance reflects the changing landscape of global health and environmental science. The 2014 updates integrated protocols for sudden emergencies and pandemics, a crucial addition that ensures healthcare systems are prepared for rapid surges in hazardous waste during outbreaks. Furthermore, the guidance addresses emerging threats like climate change and drug-resistant pathogens, recognizing that environmental shifts and evolving biology require new approaches to waste treatment. These updates ensure that the Blue Book remains a living document, capable of guiding healthcare facilities through modern crises while protecting the ecosystem from the long-term impacts of pharmaceutical and biological pollution. Infectious and pathological waste requires distinct handling procedures due to their high risk of disease transmission. Infectious waste includes lab cultures and isolation ward waste, which are highly concentrated sources of pathogens. The WHO mandates that this category requires immediate sterilization, often through autoclaving, to neutralize biological threats. Pathological waste consists of human tissues and organs removed during surgery or autopsy. Because of its biological nature and ethical considerations, this waste mandates thermal destruction, such as incineration, or deep burial in specifically designated sites. These protocols ensure that biological matter does not become a reservoir for infection or a source of environmental contamination. Sharps waste management is a high-priority area because it involves items like needles, scalpels, and broken glass that can easily cause physical injury. These items represent the highest immediate occupational physical hazard to healthcare staff and waste handlers, as a single prick can transmit bloodborne pathogens like HIV or hepatitis. Consequently, the WHO requires puncture-proof containment for all sharps. These specialized containers must be rigid and leak-proof to prevent any accidental exposure during transport and disposal. Managing sharps effectively is the first line of defense in preventing needle stick injuries and ensuring a safe working environment within medical facilities. Chemical and pharmaceutical waste covers a broad range of hazardous substances used in medical settings. This category includes lab reagents, heavy metals such as mercury from broken thermometers, and expired or spilled drugs. Because these substances can be toxic or corrosive, they require chemical neutralization to prevent environmental leaching into groundwater or soil. Pharmaceutical waste, particularly cytotoxic drugs used in cancer treatment, must be handled with extreme care to prevent their release into the ecosystem. The WHO guidelines emphasize that these chemicals cannot simply be discarded like general waste, but must undergo specific treatment processes to render them inert and safe for final disposal. Radioactive waste protocols are strictly defined because of the unique nature of the hazard involved. This waste originates from diagnostic or radiotherapeutic medical materials used in imaging or cancer treatments. Unlike biological waste, radioactive materials cannot be destroyed thermally through incineration, as this would only disperse radioactive particles into the air. Instead, they are managed exclusively via controlled physical decay. This involves storing the waste in shielded containers for a specific period until its radioactivity reaches a safe, negligible level. Only after this decay process is complete can the materials be treated as conventional waste, following rigorous monitoring and verification. Procurement and waste minimization is a proactive strategy emphasized in the Blue Book to improve sustainability. This approach emphasizes reducing the ecological footprint before waste is even generated by focusing on the supply chain. It encourages administrators to select sustainable, non-toxic medical consumables, such as choosing PVC-free plastics or mercury-free devices. By integrating waste considerations into the procurement process, healthcare facilities can significantly decrease the volume of hazardous byproducts they produce. This not only benefits the environment, but also reduces the long-term costs associated with expensive waste treatment and disposal, moving the healthcare industry toward a more circular and responsible economy. Scalability across resource settings is a core strength of the WHO guidelines, ensuring they are universally applicable. The protocols are designed to be applicable in both high-resource tertiary hospitals with advanced technology and low-resource clinics in remote areas. The Blue Book provides basic, culturally appropriate technologies for developing nations, acknowledging that not every facility has access to high-tech incinerators or autoclaves. By offering a range of options, from sophisticated treatment plants to safe, low-cost burial pits, the WHO ensures that every healthcare provider, regardless of their economic status, has a roadmap for protecting their community from the dangers of improperly managed biomedical waste. Thank you for your attention to this critical overview of the WHO guidelines for biomedical waste management. We have covered the essential frameworks of the Blue Book, the specific protocols for various waste streams like sharps and radioactive materials, and the importance of procurement in waste minimization. Understanding these international standards is the first step toward implementing safer, more sustainable practices in any healthcare environment. By following these evidence-based guidelines, we contribute to a safer world for patients, healthcare workers, and the global environment. We hope this information provides a solid foundation for your continued work in maintaining the highest standards of medical safety and environmental stewardship.